Good morning, this is Dr. Moein. Today we have an interesting case that I want to bring to you. This lovely lady, 35 years old, she comes from the East Coast, and her issue is previously she had a butt implant, and then after the butt implant she had an infection, and because she didn't have enough fat to deal with the deformity that the infection left her, she ended up getting silicone injected into her buttocks, and that silicone caused problems along with the butt implant, and now she is left with this kind of an issue where her butt is ptotic and needs to be lifted, and she's got a lot of extra irregularities on her buttocks, and unfortunately, she doesn't have enough fat because she's had multiple BBLs previously. So the issue now is we need fat to be able to remove the implant and place fat to give her some semblance of normal volume of her buttocks, and also we need to correct the ptosis after removing this much volume from her butt. And so the operation that we have devised is an interesting way to deal with this problem. She's never had a tummy tuck, and she has some tissue over here from this area to this area that we're gonna remove en bloc, and we're gonna take that fat, take that piece of tissue and take 90% of the fat by doing ex vivo liposuction and harvesting that fat, and then turn her and do a lift, a butt lift on her, and lifting all this tissue. And on table, we're gonna know how much we can completely lift. And this area of tissue, what we're gonna do is we're going to do auto augmentation. We're going to turn it in and we're going to put it underneath the tissue without taking away the blood supply. And that's going to allow us to again preserve 90% of the fat. So we have completed the marking. This is the area of skin that we're going to remove, and you can see how dramatic that is, how much we're going to remove. And we're going to spin and we're going to remove this much, and you're going to see how it helps with the lower part of the buttocks. Remove and lift everything once this implant that is in this position comes out, and we're going to continue to remove all in the front to give her a nice abdominoplasty in the front to get rid of the excess skin that's hanging and use that fat. Hello, this is Dr. Moein. So we've completed the first part of the procedure, which was the abdominoplasty to recruit fat. And on the back table, we're currently removing the fat using liposuction. That's called an ex vivo liposuction. And now we're gonna come in and we're gonna lift her and to get nice comprehensive lift of their buttocks like this, and remove the implant. The implant is this implant. And we're going to remove it from this incision, and then what we're going to do is we're going to close everything and try to rebuild her buttocks in the subcutaneous plane. So we're getting to the part that we've removed this portion of the skin so we can do a lift, and then we're going to approach the implant. The implant is So we have completed the second part of the operation, which is removal of the implant. These are large implants around 550 cc's, and then we have done a lift to lift her buttocks to decrease the overall amount of dead space, and grafted fat carefully using ultrasound in the buttocks to give her more shapely buttocks. This is one stage before. She's going to have additional fat grafting to improve her contour, but this is the maximum amount of fat her butt can accept at this moment.
We're gonna flip her and finish her tummy tuck. Hello, this is Dr. Moein. So we have completed the last stage of the operation, which is abdominoplasty closure. And you can see how nice and beautiful the circumferential procedure is. This procedure allowed to restore her buttocks, remove large implants, and take the fat from the front and replace it in the back where she was deficient.